The EOB explains how the claim was processed by the plan's administrator, and that's the point where you can check to see was everything billed correctly? Are those the providers I saw? Was it in network or out of network the way that I expected it to be? Do I have patient responsibility?
Welcome to Under the Coverage.
During each episode, we interview people, sometimes it's just each other,
Who spend their working days focused on health benefits and healthcare.
As consumers, we want the same thing you do.
We want the entire system to be less complicated.
Our guests share insights about how they navigate healthcare and the health benefits system.
I'm Jolene Myers.
And I'm Sarah Flusky, and we're ready to lament,
Complain,
empathize, and maybe help a few people.
It's not uncommon to receive bills for medical services. You go to the doctor, you have a service done, you get a bill. It helps us understand what we're getting billed for. So, when this happens, you should receive an EOB, an explanation of benefits, before you get the bill. So that should come in your mailbox before you get the medical bill. If you get those electronically, you should review them when they come in. So the explanation of benefits, the EOB, is a key to the kingdom. It gives you a heads up that a bill might be forthcoming, and you can see how your claim was processed. So what is an EOB? It's not a bill, which we just said a few seconds ago. A handle
It says
acceptance.
that on the EOB.
It sure does in big bold font. So it basically indicates that a claim has been received, and it shows you how it's been processed. So that confirms the date of service, the provider's names, and the services that you got. You can look those things over, be sure that they're accurate.
So you will get a bill after you visit a provider for a couple reasons. If you're in a high deductible plan and you have not met your deductible, so in the last episode, we talked about a dermatology visit. If you're in a high deductible plan, you have to pay $3,000 out of pocket before those co-pays or co-insurance amounts kick in. I'm going to get a bill from the provider for $145. So on the EOB, it'll say you went to this provider, you had this service done, they're charging this amount. The network discount through your insurance plan has reduced it to this amount. While you're in that $0 to $3,000 range, you're going to get a bill from the provider for that amount. And the EOB kind of outlines that. And it might say patient responsibility, and they're estimating what the bill is that you should be expecting from the provider's office. So if you haven't met your deductible, that's why you would get a bill from the provider. So another reason you'll get a bill is for an out-of-network provider. The difference on the EOB is that it won't have that reduced amount for the in-network provider because you've gone to an out-of-network provider. So where it would have said $165 for the dermatology visit, there's going to be zero network discount because it's an out-of-network provider, so you can be expecting a bill for $165 from the out-of-network provider. If you have an out-of-network deductible, it'll count towards that. Otherwise, you're just paying $165 to see that out-of-network provider, and it doesn't count towards your in-network deductible because the provider's out of network. You might also get a bill if the provider was not in network yet. So one of the things you can do is if it's somebody that's supposed to be in network or you confirm that they were in network, it could be a timing error in that gray space of, when they submit the paperwork to be joining the network and when you've seen the provider. So that would require a conversation with the provider or your benefit plan, whoever's administering your benefit plan, because there's that gray space is a difficult time to see a provider. But that could be another reason why you're getting a bill, or the EOB doesn't look the way you were expecting it to look.
Yeah, you gotta review that. So how do you resolve a billing error, right? So you get this piece in the mail, you're looking at it, you see all the different service codes, and there's a little key that explains the code so you can see how the claim was submitted to your insurance. Let's say you went to a podiatrist and it said that your toe is removed when really you just got your toenail removed. Typos, they happen. Quite a different service. So go through any discrepancies, and if there are changes to be made, they'll need to resubmit the claim.
Yeah, the provider will need to resubmit that claim if there are mistakes in what they're billing you for in terms of what you were seen for it was the wrong provider. If you can confirm that with the provider, then they have to resubmit the claim, and then you'll get another EOB. That's in a nutshell why you want to review your EOB when they come in. Gives you the heads up that a bill might be forthcoming. The EOB explains how the claim was processed by the plan's administrator, and that's the point where you can check to see, was everything billed correctly? Are those the providers I saw? Was it in network or out of network the way that I expected it to be? Do I have patient responsibility? This has happened to me, which, side quest, I get a bill or an EOB that says I'm going to owe some money. And if I've had a lot of visits lately, in my brain, I'm like on the cliff's edge of hitting my deductible. So at some point, these invoices are coming to me and I feel like I'm going to hit my deductible someplace in here. So if you're close to that point, it is worth confirming, how close am I and what bills do I owe as I get closer and closer to meeting that deductible, because sometimes they're flying in fast and furious when you have a lot of appointments sort of back to back and you have something going on. So it doesn't hurt to ask questions. So the next time we're going to talk about what counts as free preventive care. I'm using air quotes that you can't see on a podcast, and when the free visit might actually cost you money.
Yeah, that's an important one.
Thanks for joining us.
Thank you. This podcast is brought to you by Nova Healthcare Administrators.
Have a question or a situation you'd like advice about?
You can find us on X at UNDR The Coverage.
If you're into email, you can reach us at podcast@novahealthcare.com.
Don't forget to leave a review, give us a like or subscribe, but most importantly, share. We'll find the insiders.
You share it with the outsiders.